Hi, I'm Garvin. Welcome to our telehealth video series. In this video I will give a brief overview of what you need to know about cellulitis. In particular, I will cover what is it, how you treat it, and how you can live with cellulitis. So we start with what is it? Cellulitis is a serious infection that spreads under the skin, affecting soft tissues such as the skin itself and the fat underneath. Bacteria are the most common culprits, but very occasionally a fungus is responsible. Cellulitis is not contagious, but it can strike anyone with broken skin or damaged tissue. Cellulitis infections occur most commonly on the legs, arms and face. Facial infections are found mostly in infants and seniors. In children, about 1 in 12 cases of facial cellulitis leads to meningitis. Cellulitis occurs in different forms. So you have periorbital cellulitis occurs around the eye sockets. Erysipelas results in raised, firm, bright red patches of skin and is caused by Streptococcus bacteria. So necrotizing fasciitis is an infection that occurs below the skin. Cellulitis is a bacterial infection of the skin. It appears as swollen, red area that feels hot and tender or sensitive to touch. It is not contagious, which means it cannot be spread directly from one person to another. So the common causes are an insect bite or a sting, an animal bite or a human bite, a recent injury with a break in the skin such as a graze or cut, or a history of poor circulation such as varicose veins and diabetes, a recent surgical procedure, and foreign objects in the skin such as wood splinters. So the symptoms of cellulitis, uncomplicated cellulitis, begins with a small area of skin that's red, glossy, painful and warm to the touch, typically around a cut. It most often strikes the lower leg, but the arms, hands, feet and groin are other likely spots. Some types of bacteria can get into the lymphatic system, a network of tubes and nodes that carry disease-fighting cells and waste matter around the body. So if this happens, the infection can travel under the skin and spread to other parts of the body. Another type of cellulitis is Erysipelas. The inflamed skin in this type of cellulitis is not smooth but raised, often completely separated from the layer beneath by a pocket of gas created by the bacteria. There's often a fever a day or two before the rash. So the most severe complications of cellulitis are meningitis and blood poisoning if the bacteria get into the bloodstream. So meningitis can occur if the bacteria get inside the central nervous system, so the brain or the spinal cord. The most likely route is through the eye socket. Cellulitis around the eyelid is called Herceptin Cellulitis. It causes a rash that might be painful or itchy. If the bacteria get behind the seal where the eye meets its socket, the condition is called Orbital Cellulitis. This is a medical emergency and causes symptoms of fever and impaired vision. It requires immediate treatment to prevent meningitis or eye damage. If the infection gets into the lymphatic system or blood system, red lines may be seen under the skin before the main rash appears. This may cause symptoms like fever, sweats and nausea. So, diagnosing cellulitis, a doctor can usually recognize cellulitis from the skin's appearance, unless there's pus or an open wound. The responsible organism can be hard to identify. The exact strain of the bacteria isn't usually important, as typical broad-spectrum antibiotics will deal with most bacteria that cause cellulitis infections. So next is, how do you treat it? Your doctor may prescribe antibiotics, and in most cases the infection will disappear after a few days. It is important that you take the full course of antibiotics. Take regular pain relief such as ibuprofen or paracetamol to control fever you may have, and raise the infected area, so usually to above chest level. This will help to reduce swelling. Apply warmth to the inflamed or red area to fight infection by increasing the blood supply to the tissues. Rest as much as possible to allow your body to fight the infection, but keep your joints moving with gentle activity. Ensure you eat a well-balanced diet and drink extra fluids. If you suffer with athlete's foot, so it's a common fungal infection of the feet, treat this with a foot spray or cream that you can buy over the counter. So how do you live with cellulitis? To avoid cellulitis, you wear protective equipment when playing outdoor sports. Soil forced into cuts and scratches is a common cause of cellulitis. Wear long sleeves and long pants when hiking in forests, which help to avoid scratches and other injuries. And don't go outdoors in bare feet. Avoid swimming in salt or fresh water with broken skin. And keep skin clean with a mild soap. Clean cuts carefully with soap and antibacterial ointment. And change bandages at least daily or whenever the bandage becomes wet or dirty. And see a doctor for large or infected cuts or wounds inflicted by animals. Finally, there are numerous products available at Lynch's Pharmacy in Douglas to assist in managing and treating cellulitis effectively. We have various supplements and products which you can buy from us without a prescription, such as cold packs, pain medication, vitamin D. We also stock light boxes to promote relaxation. So that brings this video to an end. Customers of Lynch's Pharmacy can avail of a brand new offering, a telehealth clinic. You can book a 30-minute clinic with us. We help to increase your understanding of your illness. During a telehealth clinic, together we create a cohesive management plan which enables you to take a more active role in managing your illness with confidence. We provide you with the tools you need to live a healthy life. Call in to us at Lynch's Pharmacy in Douglas and Cork, or call 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.